Barely out of childhood, Mahani Amadou got married when she was 12 years old. She became pregnant at 13. But Mahani is not alone. Culturally, this is normal for thousands of women in Chad, a country of 10 million people in north-central Africa.
It is too young to get married, 13, 14, 15, because you are not ready.
Mahani lives near Lake Chad, 200 kilometers from the nearest hospital. She went into labor, but it took her 2 days travel by car to reach here. Her baby was stillborn at delivery. The trauma of childbirth caused a hole to form in her birth canal. This condition is known as obstetric fistula and makes a woman leak urine constantly.
The pregnancy in a body that hasn't reached its maturity causes a problem.
Dr. Kayotal Mohammed practices at Liberty Hospital.
47% of women affected by fistula are divorced. 9% are abandoned by the husband and her family. Often they live in a house far away and cannot integrate with society or live an ordinary life.
UNFPA, the UN Population Fund, is encouraging women to undergo surgery. It pays $300 for every operation and gives each woman an additional $60 to help her get back on her feet. And no one knows this better than Adama Banat, the president of the Fistula Association. Adama manages this shop where she sells linens and clothing. She was able to start her own business from the subsidy provided by UNFPA. The women who work here were all fistula patients. It's a first step back to normal life after being shunned by their husbands and families. But for Adama, she was lucky. Her husband stayed with her throughout her illness. Now she's able to earn an income and resume her regular duties. In a society where men are predominantly in charge, women often become the backbone of their families. After her stint at the shop, Adama returns home to take care of her family.
I am preparing rice and sardines for dinner.
Her daughter helps with the cooking. Besides paying for fistula surgery, UNFPA is also supplying equipment used at the hospital. Dr. Mohammed expects his caseload to increase as more and more women talk about the success of their operations. So far, 456 women have been helped. Now Mahani has a different outlook on life. After 20 days of recuperation, she'll be going home soon.
My husband can go to other women in the village. I don't care.
Dr. Jalboard Fatimatu, an expert on reproductive health at the UNFPA office in Chad, is concerned about young girls like Mahani.
Nous sommes en train de lutter pour aider le gouvernement à prendre quand même.
We are helping the government to create laws that forbid little girls' marriage.
If the law becomes policy, women under the age of 18 will be prohibited from marrying. While this will help to reduce the number of fistula cases among young girls, easy access to maternal health care is crucial for the elimination of fistula.